Hello, this is Dr. Dennis McKenna, joined again by Dr. Venditti, our hospital system general director. Today's Incident Command Day 36, providing you the update from Albany Medical Center on the coronavirus. We can report out that in the 5 counties, Albany, Schenectady, Rensselaer, Saratoga, and Columbia, there are now 1,062 patients who have tested positive for COVID-19. On Friday, we reported the number was 903. So that's an increase of about 100 patients over 3 days, or about 3% growth per day. And Fred, I think this suggests that the doubling time is spreading out.
It absolutely has, Dennis. So last week we talked about a 10% growth per day, which is a 7-day doubling time. 3% growth per day is more than 20 days doubling time. So significant flattening of the curve.
So we're going to continue to encourage people to do exactly what they're doing with social distancing and hand washing, and we'll see what happens with that number. Inside here at the medical center, we are reporting 66 patients that we're currently caring for with COVID-19, which is a decrease from Friday. Since Friday, we've had 3 patients who passed, and obviously our hearts goes out to their families. In addition to that, however, we've discharged 20 patients to home, which is remarkable. That leaves 27 patients on the floor, that leaves 39 in the ICU, and 29 of those are on a ventilator. Let's also talk about that 66 patients. We know that the 66 patients are being cared for on 7 different units, and when you look down at the breakdown of their age, we have nobody in the hospital under the age of 21, and 80% of those patients are over the age of 50. So that gives you some idea on the breakdown of the patients. On Friday, we gave an update on convalescent plasma. And when I talked about the people who were involved in this program, I mentioned the 3 doctors involved. I mentioned Dr. Subik and I mentioned Dr. Judson. But I misspoke and I identified the pulmonary critical care doctor wrong. It's Dr. David Pallett, who is not only a great friend but a great doctor. So thank you, Dr. Pallett, for all your great work here. It's a great opportunity to get Fred to give us an update on the program.
So Dennis, it's been a remarkable response from the community. We've had hundreds of calls from people in the community. We've identified 24 that have actually consented. 5 of them have actually been typed. So in order to donate, you need to have a high enough level of antibodies in your blood. Plus, you also have to be the same blood type as the person who's going to receive your plasma. So 5 individuals have been identified or in process to donate. So it's absolutely tremendous.
The first donor was actually an employee here, and we think now as the week goes on, we're going to have even more people who are going to be able to donate, which is remarkable.
Absolutely. And she's somebody you know very well, you've worked with.
I work with her in the emergency department for sure. So to remind you, if you are in the community and you're somebody who wants to see if you would be a candidate for convalescent plasma donation, 518-262-9340. And thank you to those of you who've called us already. It's a remarkable, remarkable outpouring from our community. We have 3 missions here at the medical center. We're an academic medical center, so we do clinical care, we do research, and we do education. So today we wanted to spend a little bit of time talking about our learners and the role they're playing in COVID-19. Fred, you want to start with our graduate medical education program, our residents.
Sure, Dennis. We have over 400 residents and fellows in training. So they've graduated after 4 years of medical school and they're in postgraduate training. They do a lot of clinical work here in the hospital. They're on the front lines. They're really incredibly important to our mission and the care that we provide. Doing a tremendous job.
We certainly do thank all of our residents who are caring for patients. We obviously have a medical school, and as we mentioned a couple weeks back, our medical students are learning remotely. They are not on the campus, but they're continuing to take classes via web conference or video. There is a group of medical students that have coordinated themselves and have volunteered to actually go onto the floor, working with the nurses in order to give an opportunity for patients to connect with their families via iPad. As we mentioned, we don't allow visitors onto the campus, which is consistent with all hospitals, except for very certain circumstances. So it's important for the family members to still connect with their loved ones in the hospital. Think about the families from Queens, for example. The medical students go into the rooms working with the nurses, and they set up video chats between the family and the patient via iPad. It's a chance for them to connect with the patient, to talk to them, to connect with them, to pray with them. And this is really remarkable. So we thank our medical students.
It really is remarkable, and it's very important to patients to be able to connect to their families. So that's just a wonderful thing, and it helps us with what I would call our social distancing. So as you heard Dennis say, we have really restricted the number of visitors to come into the hospital, and so this helps the patients despite that. That whole restriction is important in terms of not allowing the virus to continue to spread. And we're going to start something this week with our staff that's along those same lines. It's called standby leave. So a lot of our services, clinics, etc., have closed because the volumes are down. As a result of that, we have some employees who could actually be at home instead of here at the medical center. And so we're instituting this standby leave, which allows those people to stay at home where they're not coming in and out of the hospital and potentially bringing virus in or bringing virus out of the hospital to their homes. They continue to be paid, they continue to have benefits, and get to stay at home. Very important policy that we're starting to implement this week.
And it's called standby leave.
Standby leave.
Okay, very good. And I'm sure we'll talk more about that in the next couple weeks.
We will.
Fred, today we have shirts on. It says Albany Med, but there's more to it. What's on the back?
So this is the back. Oh. It's a pretty heart, a rainbow color. It says Albany Med Strong 2020.
And we do know the rainbow is the community symbol for how we're responding as a community to COVID-19. We've talked about how members of our workforce have worn rainbow scrubs, or there's rainbows in the windows. So we're going to ask you, if you're a member of our workforce, if you'd like to send us some pictures, email them to albanymedcommunications@amc.edu. And by the end of the week, we'll take some of those and we'll show everybody how you are all responding with the rainbow, which is great.
Yeah, I think that'll be great.
All right, very good. So we're back at work again this week. We thank all of the members of our workforce who worked all weekend taking care of patients. And we'll be back tomorrow with some more updates. Once again, we ask that you please take care of yourself, take care of each other, and we'll see you tomorrow.